popliteal fossa is a diamond-shaped depression felt at the back of the semi-flexed knee joint. This fossa is an important anatomical region because it provides passage for main vessels and nerves from the thigh to the leg. It contains popliteal vessels and the two terminal branches of the sciatic nerve. Popliteal artery is used for auscultating while taking blood pressure in the lower limb. Common peroneal nerve lies on the neck of the fibula and is the most frequently injured nerve in the lower limb. Its paralysis leads to foot drop position with inability to dorsiflex and evert the foot. Boundaries. The fossa is bounded superomedially, semitendinosus and semimembranosus. Superolaterally, biceps femoris. Infерomedially, medial head of gastrocnemius. Inferolaterally, lateral head of gastrocnemius supplemented by the plantaris. Floor or anterior wall is formed from above downward by the popliteal surface of the femur, the capsule of the knee joint and oblique popliteal ligament, the popliteal fascia covering the popliteus muscle. Roof or posterior wall is formed from the strong popliteal fascia. The superficial fascia over the roof contains short saphenous vein, 3 cutaneous nerves, terminal part of the posterior cutaneous nerve of the thigh, posterior division of the medial cutaneous nerve of the thigh, and the sural communicating nerve. The roof is pierced by all these structures except the posterior division of medial cutaneous nerve of the thigh. Contents. Popliteal artery and vein, tibial nerve, common peroneal nerve, termination of small saphenous vein, posterior femoral cutaneous nerve before it becomes cutaneous, genicular branch of posterior division of obturator nerve, popliteal lymph nodes, pad of fat. Popliteal artery. It is the continuation of the femoral artery which begins at the adductor hiatus, crosses the floor of popliteal fossa from the medial to the lateral side to reach the lower border of the popliteus, where it terminates by dividing into anterior and posterior tibial arteries. The popliteal vein accompanies the popliteal artery in an oblique course. In the upper part of vein lies posterolateral to the artery. In the lower part, the vein crosses behind the artery and runs medial to the artery. The tibial nerve passes vertically from the upper to lower angles of the popliteal fossa. It lies superficial to the popliteal vessels in the middle of the fossa from lateral to medial side. Relations. Deep surface from above downwards. Popliteal surface of femur separated by layer of fat. Oblique popliteal ligament of knee joint. Fascia covering popliteus muscle. Superficial surface. In proximal part, overlapped by the semimembranosus. In distal part, overlapped by both heads of gastrocnemius and plantaris. In the middle, crossed from lateral to medial side by the popliteal vein and tibial nerve. Laterally, in proximal part, biceps femoris, tibial nerve, popliteal vein and lateral femoral condyle. In distal part, plantaris and lateral head of gastrocnemius. Medially, in proximal part, semimembranosus and medial femoral condyle. In distant part, popliteal vein, tibial nerve, and medial head of gastrocnemius. Branches. These are cutaneous, muscular, and articular or genicular. Cutaneous. Branches pierce the roof of the fossa and supply the skin of the back of leg. One branch, sural branch, may accompany the small saphenous vein. Muscular. Branches supply the adjacent muscles. Branch to the gastrocnemius begins as a single trunk which descends in the form of Y and supplies both head of muscles. Articular. Branches supply the knee joint by 5 genicular arteries and forms an anastomosis or genicular anastomosis around the knee. Superior medial and lateral genicular arteries encircle the upper ends of femoral condyles. Inferior medial and lateral genicular arteries encircle the tibial condyles, and middle genicular artery pierces the oblique popliteal ligament. Popliteal vein. It begins at the lower border of the popliteus by the union of veins accompanying the anterior and posterior tibial arteries. Relations. Medial to the popliteal artery in the lower part of the fossa. Posterior to the artery in the middle and posterolateral to it in the upper part of fossa. The vein continues as the femoral vein at the opening in the adductor magnus. The popliteal vein receives the small saphenous vein and the veins corresponding to the branches of the popliteal artery. Tibial nerve. This is the larger terminal branch of the sciatic nerve. It lies superficial or posterior to the popliteal vessels. It extends from the superior angle to the inferior angle of the popliteal fossa, crossing the popliteal vessels from the lateral to medial side. Root value. Ventral branches of the ventral rami of L4, L5, S1, S2 and S3. Branches. Articular or genicular branches. 3 genicular or articular branches arise in the upper part of the fossa. Superior medial genicular nerve lies above the medial condyle of the femur, deep to the muscles. Middle genicular nerve pierces the posterior part of the capsule of the knee joint to supply structures in the intercondylar notch of femur. Inferior medial genicular nerve lies along the upper border of the popliteus and reaches inferior to the medial condyle of tibia. Cutaneous nerve is called sural, which originates in the middle of the fossa and leaves it at the inferior angle. It supplies the skin of the lower half of back of leg and whole of lateral border of the foot till the tip of little toe. Muscular branches arise in the distal part of the fossa for the lateral and medial heads of the gastrocnemius, soleus, plantaris, and popliteus. In addition to the popliteus, the nerve also supplies the tibialis posterior, the superior tibiofibular joint, the interosseous membrane, and the inferior tibiofibular joint. Since the muscular branches, except to the medial head of the gastrocnemius, arise from the lateral side, the medial side of the nerve is safe side while operating. Common peroneal nerve. This is the smaller terminal branch of the sciatic nerve. It lies in the same superficial plane as the tibial nerve. It extends from the superior angle of the fossa to the lateral angle. Continuing downwards and forwards, it winds around the posterolateral aspect of the fibula, pierces the peroneus longus, and divides into the superficial and deep peroneal nerves. Root value. Dorsal branches of ventral rami of L4, L5, S1 and S2. Branches. Cutaneous branches, articular branches, muscular branches. Cutaneous branches. Lateral cutaneous nerve of the calf supplies skin of the upper 2/3 of the lateral side of the leg. Peroneal communicating nerve arises in the upper part of the fossa. It runs on the posterolateral aspect of calf and joins the sural nerve. Articular branches. Superior lateral genicular nerve accompanies superior lateral genicular artery and lies above the lateral femoral condyle. Inferior lateral genicular nerve runs with inferior lateral genicular artery to the lateral aspect of knee joint above the head of fibula. Recurrent genicular nerve arises where common peroneal nerve divides into superficial and deep peroneal nerves. It ascends anterior to the knee joint and supplies tibialis anterior muscle in addition to the knee joint. Muscular branches do not arise from the nerve. However, it may give branch to the short head of biceps femoris. Posterior cutaneous nerve of thigh. It lies in the upper half of the popliteal fossa. It pierces the deep fascia about the middle of the fossa and supplies the skin up to the middle of the back of the leg. Genicular branch of obturator nerve. This is the continuation of the posterior division of the obturator nerve. It runs on the posterior surface with the popliteal artery. Pierces the oblique popliteal ligament and supplies the capsule of the knee joint. Popliteal lymph nodes. These lie deep to the deep fascia near the termination of the small saphenous vein. Anastomosis around the knee joint. This is a complicated arterial network. Location: around the patella, at the lower end of the femur and the upper end of tibia. The network is divisible into superficial and a deep part. Superficial part lies partly in the superficial fascia around the patella and partly in the fat behind the ligamentum patellae. Deep part lies on the femur and tibia all around their adjoining articular surfaces. Formation: medially by the descending genicular, the superior medial genicular, the inferior medial genicular arteries. Laterally by the descending branch of the lateral circumflex femoral artery, the superior lateral genicular, inferior lateral genicular, anterior tibial recurrent, posterior tibial recurrent, circumflex fibular arteries. The medial and lateral arteries form longitudinal anastomosis on each side of the patella. The longitudinal anastomosis are interconnected to form transverse anastomosis just above and below the patella and above the tibial tuberosity. The anastomosis supplies bones taking part in knee joint, the capsule and synovial membranes of the knee joint.